Hi, I'm Brooke. I'm a doula, and since you asked the question, um, how do I decide if I want an epidural or go without medication during birth? I just want to give you some advice from a doula's perspective. Relaxation is the ultimate goal for the family, especially the mother, during labor and delivery. Will an epidural help with your pain management? It will, and I think that it's a good thing to proceed. There are, however, some measures that you should take, like knowing what an epidural could do, reading of, even though it's frightening to read, but read of the disadvantages that could possibly come from having an epidural. I do, however, believe that it's the most effective way to medically veer from pain and to manage your pain. However, it could make your birth longer than expected, and some women actually will be dilated, say 6 centimeters, and get an epidural, or some other event will happen. The nurses rush in and out of the hospital room, and it makes you be dilated back to 4 centimeters. That is a possibility that comes with having an epidural. However, it will help manage your pain. But you could try having an epidural later in labor, because the later that you have it, the less likely you are to lose complete control over your legs and your motor skills. You can still move around, so being hooked up to the monitor does take away the ability to move by a lot. It does. It can even make women completely vegetable to the bed. Having friends, family, doulas be the ones to have to rotate you in bed and move you to find your comfort. But if you do have an epidural and you do end up losing that, I hope that you have a doula and some other care providers that will help move you to a more comfortable position and keep you moving, because the more you move, the more your pelvic is going to open, and it's going to naturally let your baby come through the birthing canal. You can have a light block as well. So the lighter the block, the more ability that you're going to have to move. It's still going to do the same effects. There has been some research on the later effects of having epidural. Perhaps it could interfere with your lactation. Those are some questions that you should ask your healthcare provider, whether or not it helps, if it affects your lactation, if it's going to make your labor go over time, if it's going to extend your labor. Those are questions you should ask. The side effects that I want to mention is that a epidural can produce a fever, and if you have a fever, your baby has a fever. If your baby has a fever, your baby is unhealthy. We don't want that. We want the woman and baby to have a beautiful, healthy birth. So the ultimate goal, regardless of if you use an epidural or not, the ultimate goal is to have a healthy, safe delivery. And I wish you all the best on that. You should, if you are trying to veer away from the epidural, or what you would like an epidural, just a light block, but you still are worried about your pain level, I just hope that you venture out into learning some self-help pain comfort measurements, such as learn different positions that you could change into that will help. Cooling cloths, and when you stay cool, your baby stays cool, you stay healthier, and the delivery will go smoother. Epidural is an intervention that could possibly be prevented, so it's not necessary to deal with pain. There are other methods to go about dealing with pain, but this is your birth. You're in control. Whatever you would like should reign over what everyone else thinks that you should do with your birth. If you could learn, this is a quote from Penny Skim. If you could learn self-help pain comfort, you could be doing yourself and your baby a favor. I do believe that you would be doing yourself a favor either way. Knowing how to keep a rhythm in your breathing, your moving, your moaning, and your thinking is going to help when you have relaxation. The three, like Penny Skim says, the 3 R's is relaxation, rhythm, and honestly, I can't remember the third one, but relaxation and rhythm are perfect coping measures, coping tactics. And so the more in rhythm that you are, the more in control of your pain that you can manage it more. So good luck on your delivery, and good luck on that. Thanks.